I tell you what, we will go back to traffic in just a moment, but Dr. Jerome Williams is here today with Jillian to answer your questions about your pets.
Good morning.
Hey, Doc, good to see you.
Yes.
Happy Thanksgiving.
Same to you and all of our viewers.
That's wonderful. All right, let's get to our first caller. I believe it's Roy. Roy, good morning.
Good morning.
Hi, what's your question?
I have a mixed breed spaniel. He stays outside in the daytime. He stays in the house at night. But the problem is he's always chewing on the back of his skin, down his spine where his tail is.
Right.
What causes that?
The most common cause for chewing in that area is fleas, the flea. So you want to check that first. Now, if it's an older dog, you might want to check for arthritis. But
Well, he don't have fleas. I know that because we don't have none in the house or outside.
And how old is he?
He's about 4 or 5 years old.
yeah, it's something that needs to be seen. Now, things like the anal gland could cause it. Even arthritis in a middle-aged dog could also do it. But again, the most common cause, and sometimes you just don't see them, and you got to look more closely, but the most common cause of chewing and biting in that area is the flea.
And that's got to be driving him. Go ahead.
Thank you, sir.
Okay.
So just go have the
yeah,
veterinarian look
absolutely.
at it, and hopefully they can determine what it is.
Sometimes it can be so hard to detect them.
Okay. All right, well, let's move to our next caller. Jimmy is in Birmingham. Jimmy, good morning.
Hi, good morning. Thank you. I was calling. I wanted to ask the doctor. I have a teacup Chihuahua, right at about a year, a little over a year old, and he has 2 sets of teeth. I wanted to find out: is this something that are the teeth going to push themselves out, or am I going to need to go in and have these removed?
They're going to need to be removed. They should come out normally at about 5.5 to 6.5 at the latest 7 months of age. If they don't, then you need to get them removed. Is a female dog? Is it?
What you say, sir?
Is it a female?
It's a male.
It's a male.
He's right at about a year old.
Okay.
It's a little teacup Chihuahua.
It's about time probably to have dentistry done. So you want to get the teeth cleaned. You can go ahead and have those removed at that same time.
Is that very expensive to do that?
No, it's not. I can't give a dollar figure, but it's something that needs to be done because what happens, the deciduals of baby teeth will cause the other teeth to be out of alignment.
Okay.
So the bite would be off.
Okay.
Okay, yes, sir. Thank you very much
All right.
for your help.
Good luck with that. Shannon is in Helena. Shannon, good morning.
Good morning.
What's your question?
Doctor, I have a dappled dachshund. He's 3 years old, and lately he has started looking at his bottom like there's something going on back there, like over the last week. And then yesterday he started, when he was walking, he would just stop and sit down, just instantly sit down. And I'm wondering, is this one of those gland issues? Do
Something's
I need to
bothering
take
him
him to the vet?
Yes. It could very well be the anal glands in the back. You can express those yourself if you're brave enough.
No.
Or you want to get him in and get him checked. Now, there's an old wives' tale that has some truth to it, where when they're biting at the rear, when they're scooting the rear along, it may be worms. Worms can get in those glands you just mentioned, the anal glands. Tapeworms can, and tapeworms are caused by fleas, so that could cause it as well. But the glands, as you mentioned, it would be my first thing that I would be suspicious of.
Okay, I guess he'll take a trip to the doctor
All
today.
right, all right, good luck. Let us know
Thank
what
you.
happens. Okay, I'm sorry, Lachlan, who's our next caller? Lynn is in Dora. Hey, Lynn.
Hey, how are you doing?
Good, what's your question?
I had been in the hospital a little bit over 2 months, and during I had somebody coming in and feeding my animals for most of the time, and then a lady recommended by my vet, was taking care of them for the last week. But my red Persian, he's about 15 years old. When we brought them in the carrier, he at first, he was fine. He was coming up to me in the recliner and everything, and then he got to going down in the in what used to be a garage. He's very lethargic. He's not eating well. He is drinking water, but when I picked him up, he's lost a great deal of weight, and I was wondering if this could have just been maybe that he didn't eat when I I was
Could he have
gone,
been mourning
or
that she wasn't
I
there?
had another kitten that had disappeared.
Right.
So
it could
I
be
don't know if they're
so many things to be causing it. At that age, I don't want to get right on it. You think about things like kidney disease in older cats, hyperthyroidism, diabetes, all of those things you want to, it's something that needs to be seen. Because when you get about 15 years old, then those organs begin to fail. So you want to get on it as quickly as you can, especially going into these holidays, and get it seen.
This is I mean, it just happened, right now, just occurred.
Right.
Well, then, if it's hopefully, then it's something that you can see what's going on there. But
Right.
it's not unusual for animals not to eat when their loved one's away either. If she's been
That's
in the
true.
hospital.
But losing weight,
Yeah,
that's one of the
it's extreme.
signs. Yeah, that's one of the things that we're concerned about with older animals.
All right, well, honey, good luck, and if you can get him seen, that'd probably be good to do today.
Yes.
All right, let's move to Denise, and Denise has a difficult question. It sounds like this morning. Denise is in Tuscaloosa. Hey, Denise.
Good morning.
Hey, what's your question?
My question is, I have a dog. His name is Christmas, and I've been having him 12 years. I got him 3 days after my mother died, so that's really an attachment for me.
Yeah.
Mm-hmm.
And he's getting old. He needs to be put down. I know he does. He's walking. He's falling. He is hurting. He is almost talking to let me know that he is in so much pain. And my husband keeps saying, "Oh, he's going to be all right. We're going to give him these aspirin." We done anointed that dog. He's done came through a many of things, but this is one I know God is just calling this dog for us to just set him
Well,
down.
let's let the doctor. I have been through this with Dr. Williams, and he's the best at telling you when you know. So go ahead. It's hard.
If you have that sense, if you have that feeling, if you have that knowing, then you'll receive the message from him that it's time to let go. Somehow or another, your husband has to get that same message, so y'all can be on the same page. But fortunately, that we as pet owners can show that love, show that compassion by freeing them and letting them go on. They don't have to hang around and suffer like we've seen our loved ones do. So I fully agree with you. If you have determined it's time, then do the thing that's the best act of love you can give, and let it go.
And Denise, I know it's hard. I've been there with Dr. Williams. He was there when my dog Shelby. We had to, give Shelby that shot, but it, you're there with them to the end. And I know it's hard, but
it's like a void, that's missing. But I'm just going to go ahead and do this, and I think it's the right thing. I know it is. I wouldn't want anybody to let me suffer like that, and my dog is like a family member, so I'm going to go ahead and do just that.
All right, honey.
And I thank you for your
Thanks for
advice
calling.
today.
Okay. All right.
Have a
Whew,
blessed holiday.
those are hard. Dr.
Yes.
Williams, thank you.
Absolutely.
We'll be right back.